Welcome, everyone. I'm Maureen O'Connor, president of Palo Alto University, and it's a pleasure to welcome you to our webinar series, At the Forefront of Mental Health. May is Mental Health Awareness Month, and I couldn't think of a better time to address an issue that many parents and caregivers are facing across the nation, and that is how to get your child or adolescent the mental health care they need. Today, we have an expert panel of therapists and faculty members from Palo Alto University and the Community Health Awareness Council located in Mountain View, California, great partners of ours. They are here to offer their best advice to help you get your child the mental health support they need. Moderating today's discussion is Palo Alto University's Dr. Kelly Coker. Dr. Coker is a professor in the university's counseling department and the faculty director of assessment and student learning outcomes. As a counselor educator for many years and strong leader in our field, she's published and presented widely in the field, and we're honored to have her leading this webinar. Thank you for being with us today, Dr. Coker. I'll turn it over to you.
Thank you so much, President O'Connor, and thank you for being here to support this really important event. And thanks to everyone for attending today. It's lovely to have you here. So, as you know, caring for a child or adolescent with a mental health concern can be challenging. It often finds parents and caregivers facing confusion as they venture to find help, and navigating the multiple barriers to obtaining help, as well as any obstacles of stigma or shame, it can be overwhelming. Today, our three experts will discuss these obstacles and also talk about some pathways to help you identify resources and support. So let's introduce our experts. Rachel, why don't you begin by telling us a little bit about yourself?
Of course. Well, hello, everybody. My name is Dr. Rachel Jacoby, and I'm an assistant professor here at Palo Alto University in the counseling department. I am also a licensed professional clinical counselor supervisor, a national certified counselor, a certified family life educator, and an OT play therapist. I have about 10 years of clinical experiences working with children and adolescents and families from about the age of 2 and up, as well as years of experience doing prevention work prior to that. At Palo Alto, a lot of my research aligns with focusing on experiences of adversities that children and adolescents and families have experienced, along with counseling training and supervision for subjects surrounding crisis and trauma work.
Thank you so much, Rachel. Darlene, why don't you go next?
Absolutely. Hi, everyone. It's such an honor to be here today. And my name is Dr. Darlene Chen. I am an associate professor and associate department chair of MA counseling program at PAU. And I'm also a licensed professional clinical mental health counselor and a registered play therapist. I primarily working with children 3 to 10 and using the play therapy intervention, as well as working with pre-adolescents and adolescents from an expressive arts approach. As of being an immigrant in the States, my research and advocacy work has been really centered on children's mental health, specifically immigrants and their mental health issues in the States, and working with immigrants' family in the States and to really support their well-being.
Thank you so much, Darlene. Joanna, thank you so much for joining us today. Why don't you tell us a little bit about yourself?
Thank you, Dr. Coker. I'm so happy to be here for Mental Health Awareness Month. My name is Joanna Carson-Young, and I am the Director of School-Based Services for CHAC, and this is a local community mental health agency. And as Director of School-Based Services, I oversee mental health services that we provide to our local school districts. We have Sunnyvale, Los Altos, and Mountain View school districts where we provide mental health services for K through 12 students. And I am really passionate about that because I know that for many of those students, they would not receive mental health services if it were not for those no-cost services that are right there in their schools. We also know that best outcomes for students are really dependent on incorporating those school voices and their family voices. And so it's really important for us to be there and to normalize mental health as part of their school day. So I'm really excited to be able to oversee that for CHAC. I'm also a licensed marriage and family therapist, and I still maintain, even though I work full-time for CHAC, I maintain a very small private practice still, where I really work with couples and families. Yeah, I'm very happy to be here. Thank you.
Thank you so much. And we really value all the expertise in the room. As therapists, we all know that children can't always articulate their problems or may not always let folks know what they need. In your opinions, what are some of the signs a child might exhibit that lets you know that they could be having some kind of mental health issue? Rachel, would you like to kick us off?
Of course, thank you. So one of the things that I would like to highlight is that you as a parent or caregiver know your child. And so if you start to notice behaviors that are not their norm, those are starting signs to highlight that something might be going on in their life. Look for behaviors like withdrawing, trying to avoid social situations or social interactions, isolating themselves a lot more, or look for also mood swings or grand changes in behaviors like irritability. Listen to their words as well. So if they're talking about feeling inadequate, if they're talking about feeling hopeless or like they're not worthy or people don't like them, those are key things that we want to pay attention to. Those are often our starting signs that they need a little extra support. I would also highlight level of activity changes as well. If they typically love going outside, taking walks, playing games, and all of a sudden you see a change in that interest, that also is a key indicator that something might be going on. I would like to pass this on to my colleagues to add if they would like to. So Darlene, would you like to add?
Yeah, absolutely. So like what Rachel just shared, what we are sharing here is not like, oh, if the child showed these symptoms, that means that your child is maybe suffering or having mental health issue. However, what we're trying to provide here is we trust that you know your child the best. And therefore, if you're thinking about maybe that's part of the norm. And for example, sometimes they would using not words, but showing a lot of like behavior, because developmentally, that's the way they are trying to cry for help or showing that, hey, I need some help right here. So I would encourage parents and caregivers, and even I know maybe some of our attendees here today are clinical mental health professionals, to really pay attention to any somatic symptoms. And sometimes that doesn't really, that will show up like saying, oh, my head hurts, or I feel nauseous, something like that. Or I would also encourage you to pay attention to maybe the children will be sharing, I have hard time falling asleep. I don't know what's really going on here. I have nightmare. I don't know what happened. Or having a hard time getting up, feeling restless, even though they already have like a 9 hours of sleep. And for example, that my clients, some of my clients are not, the English is not their first language. So what they're trying to share would be like, oh, something going on right here. So they will literally like point out using the body language. So as a professional, mental health professional, I will also encourage you to really pay attention to that nonverbal communication, and for caregivers as well. Right? Joanna, what do you think?
Yeah, I'd love to just add on to what you both have shared already. I think the important piece about the what's normal development, and remembering that teen brains, adolescent brains are not fully developed, their bodies are not fully developed. And so there are some things that they may need, like extra sleep, that may look like a concern. And so it is really important to think about what's normal for your child, which was already mentioned, and then what is kind of part of a healthy development, a typical development. It's really important to kind of keep those things in mind. And I think another important piece is those stereotypes that are out there in the culture about teens. And I think often behaviors that could be sort of little red flags are often seen as, so, oh, they're just acting like a normal teenager. They're moody. They're sleeping all the time. That's just how they are, or they don't want to get along with family and things like that. I think there's a lot of stereotypes out there about teens. And so sometimes some of those symptoms that we're talking about can be masked by those stereotypes. I think for me, when I'm thinking about working with teens, do they have healthy relationships within the family and outside the family? And that's kind of also a good gauge to think about is, do they have good relationships with people?
Yeah, I love that. I'm sort of picking up consistent in all of your message is that we really recognize as mental health professionals that parents and caregivers are the expert on their kids. So we really look to you and your expertise about your children. And I think the other key thing you all were saying is sometimes what you're paying attention to is what's a shift, what's a change, what's something different, but also keep in mind that children and adolescents are changing and developing beings. So changes are also happening in a very typical way developmentally. It's a lot to kind of figure out and wade through. So if you are a parent or caregiver and you really do feel like there's something beyond the pieces that we just mentioned, and I really would like to reach out and seek help, but sometimes I think families are faced with a social stigma around seeking mental health services, either something they've actually experienced or maybe something they're worried about or they're anticipating. And so I wonder what you all think in terms of what some of the fears might be about that perception of what it means to seek counseling or seek therapy, and how could some of those things be addressed?
I would like to start giving you all just a little bit like what it really means that when you hear social stigma, and maybe you have heard another term, public stigma. We actually use those two terms interchangeably, and those two terms are mainly involves like there's like negative reactions, even like discriminatory attitudes that others have about toward your mental health conditions or your well-being, your behaviors for children. Again, it shows a lot of behavioral issues in the classroom, right? So it's that public stigma around the attitude, how the other people react to your situation. I actually also want to introduce you another term is called self-stigma. So self-stigma actually means how you feel about yourself, how you perceive your own mental health conditions. And sometimes that will involve like you internalizing those shame, feel bad about myself, like why am I feeling this way? That actually happens a lot to teen clients. They will have that message like, what's wrong with me? Something wrong with me. Why I act differently in the classroom setting. Maybe socially, academically, in multiple ways. So mainly that I want to say that go hand in hand. Unfortunately, it's a really reciprocal relationship. And research actually has shown that especially marginalized populations, what I'm talking about here, it could be like people of color, or maybe LGBTQ teens, children in those communities, they actually tend to have a higher self-stigma and public or social stigma that Dr. Coker just shared. Unfortunately, those stigma are not helping. They really will intervene the clients, your children's or families seeking mental health help or just help seeking behavior in general. So I want to share a little bit about my clinical experience. Again, I want to use immigrants families as examples. So what I have seen a lot is that what Kelly just shared, that hesitation. Like, I feel like something's going on here, but I'm also not too sure. I'm worried that how other people might see me, or how my people might see my children if we as a family reaching out, seeking out for help. And however, a lot of time, children are ready. I think children are the one telling the parents, caregivers, at least my experience, that they're the one tell the parents that I think I want to see a counselor. And I think because the school has been doing a fantastic job promoting the importance of mental health, the resources are out there. So children a lot of time like very aware what their needs are. Unfortunately, that parents are not the one ready. So I actually encourage you all to pay attention and listen to, if you are working with parents, pay attention to what their fears, where their hesitation coming from, and what's the underlying reasons that prevent them from seeking mental health services, or maybe just like other resources in general. So I truly listen and understand their fear and concerns. That's what I found being very helpful. And some concerns that I have heard a lot is, well, I'm just not familiar with the system in the States. I don't even know where to start, right? Not familiar with the medical system here, mental health services. I don't even know who should I ask. What's the difference between therapists, psychologists, psychiatrists, right? And there's also some fear around language barriers. So as a mental health professional, once I understand their fears, hesitation, that's where we can start to help. There's where we can maybe start thinking about seeking out resources, or maybe walking through the process, what to expect. A lot of times that really helpful. And Rachel, Joanna, what do you both think?
Yeah, that was so well said, Darlene. And just to add to that, I was reflecting on some of my own clinical experiences as you were sharing about yours. And I can think to a couple times where I've had families say, well, we don't want our child to know that you're a therapist. We're calling you a feelings teacher, which I do teach a lot about feelings. That is a component of my job. But when we don't talk about the title of seeking help, that adds to that stigma component, and it adds to feeling shame for seeking help and support from a person who's trained to help and support you in various ways that you might need. And so it's really important to talk with your family dynamic, your family system, of what counseling really is and how we can all benefit from it in one way or another. So even if a child might be the client, the family as a whole system still benefits from the services that a counselor offers to that child. I always say, yes, you as the child are my client. You're the person I get the honor and privilege to work with and spend time with. But I'm also very much working with your parents as well, and maybe your siblings as well, and how we can communicate and support one another and help facilitate growth as a whole system, rather than just seeing one person as the key player and everyone else working around, like everyone else just kind of doing their own thing. That's not how counseling works. And so when we normalize conversations around what is therapy, as you were saying, Darlene, and normalize conversations about getting help and seeking support, we also are helping ourselves take away that stigma. One of the things that I've really found valuable from some of my older clients as of recent is that they are talking about mental health with their friends. They're talking about what they see on TikTok and Instagram and Facebook. And I won't deny that those aren't always the most reliable sources to seek mental health information from. However, at least they're talking about it. And that's what we need to have that starting conversation to normalize the whole concept of mental health and how we all have our own unique experiences, and we can all benefit from support from those experiences at one point in our life or another. So, Joanna, would you like to add to that?
I just think part of what, Darlene, you were talking about marginalized communities and how their behaviors may be more scrutinized even. And so that's something that we see a lot in our school-based services, who is being referred to us for services, and often it's those behaviors that are scrutinized that trigger that referral. But also, normalizing, exactly that word normalizing is something that we talk about every day, which is just normalizing asking for help. I remember one little kindergartner that we had in our school-based services. We were teaching SEL lessons and feelings, and it's okay to have feelings no matter what they are. And saying, well, now I know it's okay to be upset. And we really, really want to be able to take away that feeling of shame, that if you need to ask for help, that's a sign of weakness, that's actually a sign of strength to ask for help. And we really, really want to have that message. And I think for adolescents, often they're worried that talking with a counselor, you might tell their parents everything they say. And so we're really careful about talking about, there are certain things regarding your safety that we may need to disclose, but other than that, we're creating a safe space for you to be able to really share how you feel in an environment where that's non-judgmental. And then you're able to feel like you at least have a safe space with the counselor. So, and I know that as mental health practitioners, we've probably all heard stories of people who have been to other mental health practitioners and have had a bad experience, honestly. And so it's really important when we're working with students and parents to approach in a very non-judgmental way and with cultural sensitivity, and not necessarily as kind of the experts, that we really want to approach families and children too, and that we want to hear from them about their experience, and just being very sensitive to different ways of doing things.
I have a follow-up question, Joanna, and I'll admit I'm asking it partially to the expert in the room and partially to the mom of an 18-year-old. But have you found that to be true, even with your own child's peer group? That piece Rachel was talking about, how at least one of the things we're seeing in social media is maybe an enhanced conversation about mental health and mental illness and sharing concerns. Has that given us any movement in kind of overcoming some of the stigma? Do you see that among young people?
I do see that, and I do see that as a positive. I do think, we're having more conversations. And so, Rachel's point about maybe it's not always the most reliable source of information, because there is that other side to it where sometimes, as they're sort of doing this identity formation piece, they're latching on to kind of particular diagnoses that they're hearing on social media as sort of an identity that they're trying on. And that can, there's some pros and cons to that. But I do think one of the benefits is at least it's a conversation starter. And we're finding adolescents especially are much more savvy about mental health language and diagnoses and things like that. So they're coming in kind of already with some ideas about that. But then we get to help kind of with that psychoeducation piece and help them sort through all of that information that they're getting.
Thank you for that. I feel like, a lot of our audience are parents and caregivers as well, and really kind of thinking about the reason you're probably here is, you are the best advocate for your child, right? You are the person who knows what's going on with your kid, who wants to get them the help that they need. And so I think as mental health professionals, we really lean into that. We really lean into parent and caregiver as advocate. So in your opinions, how can parents be their child's best advocate when it comes to addressing some mental health concerns? And I'm not going to let you off the hook, Joanna, to be able to go last this time. I'll let you go first.
Okay. I think something that is so difficult for us as parents is to kind of do that non-judgmental listening piece that I mentioned a minute ago. It's really painful when our child is maybe struggling or having some challenges, and we want to be able to fix that for them or help them fix it. We all have judgments, we all have biases, and it's really hard, I think, as a parent to kind of step back and just listen in that non-judgmental way. Really, really important, however, when you're advocating for your child, to be able to first listen. That's the best kind of first step for advocacy, is to truly listen and, sit on your hands, do whatever you have to do to kind of keep those kind of judgments or those impulses to kind of fix those things. Because I think listening without judgment is such a great first step to really hear, okay, what does my child need? Do they need to speak with a counselor? Is there something else that they might need? And I think adolescents, children are often afraid to talk to their parents about these things because of that judgment. And we can't help it as parents sometimes to rush in there and be like, let me help you fix this. But it's really important to also listen to feelings, no matter how challenging they are, without trying to put that kind of positive spin on it. I think often as parents, we're jumping in and kind of saying like, oh, but don't worry about that, because look at this other thing over here that's really good in your life. And that's so hard not to do. And I do it myself. But I think it's really important to kind of really listen to those challenges and be okay with challenges. Challenges are a part of life. It is normal. And we need to be able to listen to those. So when you're advocating for your child, I think those are really good first steps to take. Darlene, or
Yeah, I have to say that listening piece is the easiest way, but also the most challenging, difficult way to approach when we want to really truly listen to the children trying to convey those messages. So, for example, that what I heard multiple times from my child clients is, yeah, my parents tell me all the time, don't feel this way. Like what Joanna just shared, it's not big a deal. You shouldn't feel this way. Look at all the positive things, like all the positive sides that you have done. Well, unfortunately, that will push the child away. The children will feel unheard. And further down, they will stop like sharing more information and emotion thoughts with you. So parents like to tell me that whatever you do seems works because my children say they just want to talk to you, not me. And when I introduced them these skills, like listening skills, they were like, wait, what? That's just what you did? And I said, yeah, let's take a little bit time, like practice the listening skill here. So yeah, Rachel.
Yeah, you guys both highlighted such key components of that. And just to like add some techniques to one of the things that I've really loved encouraging some of my families to do is finding a spot in the home or maybe outside of the home that you don't typically go to, but you have easy access to. Maybe that's a couch that you don't typically sit on, or maybe you have a porch swing and you can sit on your porch, or a stoop that you can go to. And when the child leads the way and goes to that spot, that's their way of saying, hey, I need you to listen to me, and I need you to do so in a really non-judgmental way, without criticism, without punishment. And whenever families typically like really buy into it, get on board, it helps increase communication. And if you don't have access to a spot in your home, a spot outside of your home, that allows you that privacy, and for you as a caregiver or parent to notice that your child has gone to that space, having a password, like a something that you say out loud. Like I've had some families pick a silly word that makes them smile, but also has a lot of deep meaning, like pickle. Like if we say pickle, that means that we need to go have a conversation and I can't get in trouble for what we're going to talk about. but at least you know I'm willing to talk to you and trust you. And it could go both ways, where the parents say that to the child, and the child can listen. But one of the things that parents really need to be cognizant about, and caregivers need to be cognizant about, is being really directive in what they're saying, not sugarcoating words and tiptoeing around words. So I love I statements. I love modeling it for families with really, really young children and with older children as well. One of my favorite stories to say is, I had a family many years ago, and we were working with a child between the ages of 2 and 3, and we were modeling I statements in my office, and the parents struggled to do them at home, but they tried. And one day the child was home playing with a toy, their sibling took the toy, they were upset, and instead of having an outburst like they would normally do, their response was to say, "I feel angry that you took my toy." And of course, it's not a perfectly stated I statement, but that was good. And that was articulating your feelings and saying what they needed to say. And then the parents could intervene without feeling like they were, flooded and overwhelmed, because the child said what they needed to say and they were starting to recognize their feelings. So as a parent too, be really direct with what you're noticing. I noticed that you are feeling a little bit more withdrawn. Is something going on that we can talk about? Or what do you need from me in this moment, and how can I support you? So,
Yeah, I love those tips that Rachel just shared, especially that password. I love that so much. One thing, however, I want to highlight here is, what about working with teens? What if you have a teen in your family? I feel like that's a totally different story we're talking about, right? So for teenagers, a lot of time my teen clients would complain about, "Oh my goodness, my parents just asked me like 10 questions today." And however, we sometimes have to respect their space. And when they say no, or when they say, "I don't know," and that might indicate that either they don't feel comfortable sharing right now. It doesn't mean that they're not going to share with you later, but maybe right now. Or maybe they're just also trying to figure out what's going on here. Maybe that's really, I don't know. And so I would encourage parents and maybe counselors here, when you can share that piece of information during the parent consultation. So like what Rachel suggested, maybe we can share something like, "It seems you don't feel like talking about that right now." And sometimes that's okay. And honor the child the space, and also let them take the ownership. Maybe we can, whenever you are ready, we can talk about that. And I'm here. And I'm pretty sure that the team will feel very understood and validated.
I just want to add about questions, Kelly, because I think that's such a great point. Questions are really hard for all of us, actually. And I think that I know for our clinicians in training, we often talk about like, ask less questions, how about you don't phrase it as a question, because really when people feel like they're getting a lot of questions, teens especially, they shut down and they just, they say, "I don't know" a lot. And so trying to phrase things in a way as a parent that's not a question, but just an observation, or just a reach out that I'm here when you need me, is such an important point, I think.
Yeah, there were a couple of things that came up in the Q&A, and I thought I would just bring them forward now because they sort of relate to what we're talking about. The question is this: schools seem to notice children who act out, but children who are quiet seem to fall through the cracks since they don't disrupt the class. So how can a parent speak with the school, the teacher, or the counselor, principal, whoever, about their concerns if there isn't some evident or obvious behavior going on?
I think that's absolutely right. Those students do tend to fall through the cracks or not as noticed as much. I mean, I think also grades are kind of that one indicator that if grades are falling, people start to notice. But what if that's not happening? I think the good news is that our schools are starting to really recognize the importance of mental health in overall health and in school achievement and school success. And so that's the good news. I think there's more events on campus. I know in our local districts in Mountain View and Los Altos, there are mental health ambassadors that are students that are there to talk with other students about mental health. And so I'm hoping that just culture of openness about mental health for those students who might not be standing out in terms of behavior or grades or those kind of acting out behaviors, that just hearing about it on campus and knowing that it's on campus, it helps to kind of get them thinking, maybe I want to talk to someone. And it also helps for parents if there's already mental health services in place at that school to be able to talk about it with their school point people or administration about it, because chances are, especially these days, as it's becoming more and more actually mandated by states, schools, public schools, but also private schools have more mental health services on campus. So chances are that's happening on your local campus.
And I have to say that's actually kind of aligned with the advocacy work that we shared earlier, that I'm really actually very excited to learn nowadays more and more teachers, school personnel are interested and eager to learn more about children's mental health. For example, they are learning about more trauma-informed classroom management, something like that. So I'm really hopeful that more teachers are becoming aware that acting out is not the only way that is a warning sign. A lot of time, like maybe withdrawal or someone like who's really quiet, not like interacting a lot with peers, that can be another way we might want to pay attention to. But how to help parents to speak their observation with the teachers, I think again that you are definitely the expert of the child. So bring this up and share your observations, having a discussion with the teachers, and that can actually help the teachers pay more attention to your children's behavior in the classroom.
Advocacy and collaboration are so key and critical to those conversations with teachers and other school administrators and personnel to just make sure that your student has what they need. And if they don't have what they need, how can we find a way to support them in various ways? It is important to note that every state does have different regulations with resources, including school counselors. Like I live in a state where school counselors in elementary schools are not required, which does become a limitation for how schools can support children in their mental health needs. And so as a counselor, you're always welcome to go collaborate with school personnel and teachers. They open it, they would love that. And so if you see something going on in your community, like maybe there's a lack of resources, especially in some of those rural areas, reach out to the schools, volunteer to do a presentation for teachers, volunteer to do a presentation for kids, to see how you can support them and help them understand how to ask for support and resources when needed.
So Rachel, I just want to come right back to you on that, because I think what a lot of people sometimes are faced with is really finding what is the right resource for my child, what is the right source of support. And finding a counselor isn't always easy, let alone finding the right fit, right? The right kind of counselor or therapist for your child. So let's talk a little bit about this. Where do we start in finding out what kind of counseling help is out there?
For sure. So there are so many different counselors out there who hold so many different styles of how they practice. They might come from different theoretical orientations. They might have different training. For example, I know Joanna is a marriage and family therapist, which is a very unique training. And Darlene is a registered play therapist, which is also a unique training. And I have my play certification. Sorry, can't say words. And that is, again, a very different and unique training. So look into what you feel like your child needs. It's okay to interview different like counselors and professionals to see who's a right fit, but trying to find that right fit is really key. So you might dig into resources like your pediatrician or physician. I know that every pediatrician in my area has a mental health counselor list. And a psychiatrist list, and who to refer out to, and just how they can provide that resource to their patients. Other resources to dig into might be through your own insurance. So every insurance company has a list of providers who are paneled with them. And so what that means is they accept your insurance. Now, just because a provider doesn't necessarily accept your insurance doesn't mean you can't see them. For example, if Darlene doesn't accept the insurance that I have, and I would like to bring my child to Darlene, it doesn't mean that I can't necessarily not bring my child to her. She might accept out-of-pocket fees, or she might be an out-of-pocket provider or out-of-network provider with the insurance agency, and the insurance agency still might reimburse me for seeing Darlene for services. You also might dig into your academic resources. So ask your school counselors. Most school counselors do have a list of referrals within your community, and they might have practitioners at the school, just like Joanna shared. There are also a ton of online databases, like Shrink Space is one. I use Psychology Today a lot. I really like that resource. You can look at organizations like NAMI. Your local NAMI might have a list of counselors, or the Association of Play Therapy, the National Board of Certified Counselors, or you might just kind of do a Google search for your area and see what's going on. But if you do feel comfortable, ask friends and family for connections as well. Some of my biggest referral sources have been from friends of friends of friends of friends. So, keep that in mind, that everyone might have a connection to a person who might be a good fit for you. And you're welcome to interview and ask around to see if that person really is a good fit.
I like this idea of sort of finding the right fit for you, because even on our school campuses, when we provide mental health services, sometimes that's in collaboration with other mental health practitioners. So sometimes the student, and of course, looking to your school to see what they have to provide is a great resource. And sometimes that's also not enough. Sometimes, there can be school services can be inconsistent. There's breaks, there's tests, there's things like that can interfere with kind of regular counseling appointments. And so sometimes we act in partnership with other practitioners outside of school. So it's really important to know that, it may not always be a great fit, and you may need other things, and it's okay to kind of look around to see what's really the best fit for your child.
Yeah. And one thing I want to add here, that actually during the pandemic, a lot of children actually seeing their counselors online. And now it seems to have become a trend that a lot of people would rather see the counselors online than in person. And however, again, I want to say it may not be a fit for everyone. And especially children, we have to think about developmentally. How can I expect the child to sit in front of Zoom, for example, for 30 minutes? There's no way. So again, go back to Joanna and Rachel just shared. I think talk to the therapist, get to know more about their format. I think a phone consultation, some counselors, not all counselors will provide that 10-15 minutes free phone consultation. Take that advantage, take that opportunity to get to know the counselors, right? And to get to know if they understand your child's needs. And as what I found is really helpful, just that the initial contact with the counselors, get to learn more about their approach, right? Maybe for me, I most of the time using from a play therapy approach, right? That's the time you get to learn, oh, what does that mean? The other thing, what I heard a lot from parents is, well, how can I know my child's progress? And that, again, that's their hesitation, their fear. Do I want to move forward? Do I want to take my child to you? So that's the time, again, ask your therapist, ask the potential counselors, when can I hear from you? How often I can hear from my child's progress, something like that.
I love in all those responses, what I took away from that is that parents and caregivers probably already have really good connection points that are at least starting points to open up the conversation, get a list of referral sources, start having some of those interviews, trying to find the best fit for their child. The other thing I always think about way back when I was working in the schools and working with kids is that sometimes kids also benefit when you're trying to seek services and support from things other than counseling and other than therapy. My office was really close to this Kung Fu dojo in my town. And that became a primary place where I would say to parents, take your kid there. They're really going to benefit from that. That's going to help them just as much as sitting down and talking to me for 30 minutes. So what are some of those other resources in your experiences and sources of support? It isn't always just about counseling and therapy. So what else can parents and caregivers do with their kids?
Kelly, you're right. That's absolutely right. That counseling and psychotherapy are definitely not the only way that you can support your children's mental health. Though we have been talking about like how to find counselors, what are some warning signs. However, there are so many ways that you as a caregiver, parent, and even mental health professional, that's something we can continue to advocate here is what are things that you can do to avoid that downward spiral, right? So again, my few suggestions here, pay attention to those early warning signs. And once you observe that, that's a time we don't always have to go to, oh, you need to see a therapist, you need to do the psychotherapy. However, I think the easiest way, but also the most difficult way is listen to your children's needs, their thoughts, their feelings. And by validating those, a lot of time, they will feel like, oh, okay, I feel heard. I don't feel stressed anymore. I don't feel anxious anymore. They just need a little bit of support right there. The other way you can find support, there are tons of community activities out there, but I also want to be mindful that not every community is as rich as maybe some rural area. They don't have that many community activities. There are some clubs, school resources. They always have like really meaningful and I want to say helpful activities that your kids can involve or volunteer. I encourage kids to get involved more in like community work. One more thing I also want to highlight is play. Oh my goodness, outdoor, summer, springtime right now. I want to say the benefit of play, the benefit of outdoor time is sometimes so helpful. And thinking about in the past 3 years, oh my goodness, yes, been 3 years, the pandemic, your kids have been sitting in front of computer, doing the online learning, online schooling. Sometimes it's also not helpful for their mental health. So I just want to highlight there the outdoor time.
I think for me, I'm thinking about, humans as relational beings, right? So relationships are so important. And so there might be other ways, and even in counseling, really, we're building a positive relationship there. So, but counseling is not the only way. There are other ways to kind of build positive relationships. And sometimes that is through clubs and activities, finding out what interests your child and really expanding on that. I know at CHAC we're doing Lego groups and things like that, where, it's a relational activity of course, there are some children who have some neurodiversity, and maybe the kind of traditional ways that we think of activity and interacting may not be a good fit for them. And so we want to kind of be creative in those ways about what that might look like, what connection for them might look a little bit different. But I really appreciate, Darlene, you're saying that time for play, because I think especially I'm coming from Mountain View, and it's a very high pressure, high success, high achievement kind of culture. We really, really, really need to give children and adolescents time for freedom of expression, and that freedom of expression can be just very healing in itself. And so allowing for that time is really important, unstructured time.
I love these resources so very much. And I also agree that the unstructured outside time is so healing, especially if you live in a part of the country where it's not warm all the time, it's not sunny all the time. It does impact your mental and emotional well-being, and that connectivity to other people is so key. One of the things that I really love in my community is that we have for children who come from backgrounds of financial inequities, there is a boxing club, and it's free to all members. And then our community also has a partnership with the metro parks where children can go and have learn how to garden and grow things from the earth. And I've seen that coming more and more common in so many different areas, especially urban areas are really trying to make that a more communal outlet, a resource. But I also want to highlight some of the interdisciplinary resources that are available to us too, that we could collaborate with, and that might also support children and adolescents as they continuously grow and understand themselves. One of the things that I really like to recommend to families when I see a need for it, especially for those neurodiverse populations of children, is seeking out occupational therapy, because that helps us connect with our body and the somatic experiences that we might be holding in our body that are connected to our emotions and our behaviors, as well as, connecting with psychiatry if needed, if medication management is needed, connecting with your pediatrician just to make sure that everything is up to date and we're getting a full body checkup for how we function, what our needs are. And so in addition to that, really, really key and crucial outside interpersonal realm of things, we also have to make sure that we are paying attention to the medical component of ourselves. But I also want to highlight that sometimes that might not be accessible to everyone. And so if accessibility becomes a limitation, one of our roles that we can do is help try to find resources to increase accessibility, whether that's coordinating care with a case manager to make sure that there's transportation to allow and encourage a child to get to the supports that they need, whether that be the boxing club or the community garden or a medical appointment. And if you do have insurance that is able to support you in finding care coordination, really dig into that, just so that way you can help facilitate interpersonal growth, physical growth, healthy development, and we're really checking all those boxes for those children and adolescents.
Knowing that sometimes even when somebody has made the decision to seek help or mental health services, we are still dealing with a bit of a shortage of mental health providers for children and adolescents. So what should a parent or caregiver do if they have sort of made the decision, they're planning to get started, but they have to wait for counseling services to be available for their child?
Get on that wait list, right? The wait list probably is not as long as they anticipate it to be. There are openings that come up all the time. And so rather than abandoning ship, jumping ship, still put your name on there, because there's a possibility you could get in sooner. But there are a tremendous amount of resources that we can dive into for young children, adolescents and parents and caregivers dip into bibliotherapy for some of my younger kids and with my own child. I love the book collection, a little spot collection, which highlights different feelings. Every spot has a different color, and that color is representative of a feeling. And there's one book that connects to all the different feelings. And then each spot has their own individual book too, which is very, very cute. There's different variations of things like that as well. And I really love recommending podcasts. One of the podcasts that I really like right now, which is designed for parents, is called Be a Problem Solver. Presenter is Dr. Corey Clark, and he and his wife lead it, and they are just outstanding in navigating different parenting obstacles that they've faced as parents, but also as counselors, and how they help support people as they navigate those different obstacles. So those are just some of my resources I would like to share.
I would say, while you're waiting for services, if you've decided to go the route of waiting for mental health services and there's a wait list, while you're waiting, tapping into your child's strengths or your adolescent's strengths. There is something, they have some strengths, your family has strengths that maybe have not been kind of identified in an outward way, but something is helping that child or adolescent get through, even if they're really struggling. So I would say really identifying as a family what their strengths are, what your strengths are as a family, and tapping into those strengths in order to kind of help bridge until you're able to get services, I think is an important component.
The last thing I want to highlight here is sometimes your child does need immediate help right here. So I encourage you really, again, pay attention to those warning signs. However, when it comes to like a pretty severe, for example, your child starts saying that I'm feeling like hurting myself, or you start observing some self-harm behavior, and that's a time there's no way you can wait. And there's no way you can, make a phone call and wait on the wait list. So we also want to provide some resources, for example, crisis hotline. And now there's a new method. You can either text or call. There's a number called 988. And that's where you can get immediate help. So we just want to highlight multiple resources out there, and please don't overlook those warning signs. Sometimes can get pretty serious.
Thank you so much for that reminder, Darlene. I feel like what we've been talking about tonight is knowing that when children and adolescents have mental health concerns, they certainly are going to happen on a continuum. And part of being that expert on your child is really being able to pay attention, and not that it's your job to absolutely diagnose the severity of a concern. But if you're worried, trust your gut. You know this person, and seek the services that are commiserate with your concern. I think that's a really important message. Well, I just want to close by thanking everyone for joining us today. I want to thank this amazing group of experts, our panelists, for a wonderful and very informative discussion. Just as a reminder, a recording of this webinar will be emailed to everyone who attended in a few days. And you can also find it and other webinars that are sponsored by Palo Alto University on Palo Alto University's YouTube channel. If you have further questions about this webinar, about anything else we're doing at PAU, anything we didn't get to tonight, feel free to email externalaffairs@paloaltou.edu. And I hope everyone has a wonderful rest of your day, a wonderful evening, wherever you are in the world. And thank you again for joining us.